This is the healthcare supply chain presentation. First, I want to start off with the idea that supply chains within the healthcare industry haven't always been these complex, sophisticated models that have a multitude of steps. As a matter of fact, supply chain management within the healthcare industry has been very simple, but managed to evolve over time into the modern systems that we have today. Originally, most of our healthcare supply chains were transactional. They were very basic, where one employee would simply fulfill the desire that was requested by both the physician and the patients during their point of care. There was no complex outsourcing or insourcing. It was just a very simple procedure. Granted, what else would you expect from one of the very first healthcare supply chains? Eventually, as time grew, hospitals began to involve themselves with intermediary organizations in pursuit of supplies for an affordable price. They realized that they wanted to lower their costs. However, they did not think about implementing any effective business strategies within the supply chain. Soon enough, as hospitals began to grow and develop, they became more and more innovative as they realized that in order to achieve great success within their field, they must take a deep dive into their own supply chain. Next up, I would like to talk about all the factors that have influenced the hospitals in order to reevaluate their supply chains. The first factor is opportunity. Most hospitals would analyze all of the business aspects and realize that they had an opportunity to save a decent amount of money if they somehow managed to streamline and systemize all of their purchasing decisions. When hospitals and healthcare systems were looking at the numbers, they realized that a majority of the costs were driven by physician preference items, which is why hospitals decided to try and attack this problem first. Hospitals were under a lot of pressure to lower their costs while maintaining the same standard quality that was expected of them. Hospitals faced several price increases in the supplies department, and it actually accounted for around 17 to 30% of their overall costs. Then, hospitals also found out that they had the opportunity to improve upon their management and professionalism. Hospitals realized that they had to be able to manage their supply chains in order to minimize their supply costs. Most hospitals began to borrow larger corporations for their supplies in an attempt to come up with a solution. The next slide I will be talking about is the challenges that previous supply chains faced versus the challenges that our modern day supply chains face. The biggest challenge that most healthcare supply chains faced in the past was lowering their overall costs while increasing the quality of their product and service. Now, they had a different amount of ways of going about this approach. One way was the fact that they could try their best to lower the costs of their supplies by trying to create a standard set of tools for their physicians, rather than giving each physician their own, specific personalized tools. Another way that they could have gone about this problem is by outsourcing to larger companies and corporations in an attempt to buy more supplies for a cheaper price that they were currently paying for. Now, if we look at the modern day challenges that these supply chains faced, we have to find a way to integrate the supply chain role into an executive leadership role in order to create a completely unique experience for the consumers. As time went on, healthcare systems realized the importance of supply chain management and how it could benefit their businesses. Modern day healthcare systems now want to go above and beyond and make hospitals feel like they are more of a luxury hotel getaway rather than just a location to recover for the sickly. Now, let's take a look at an example of a hospital that actually implemented these supply chain strategies. The University of Pittsburgh Medical Center decided to take matters into their own hands and invested in a warehouse that is over 150,000 square feet in order to move the costs and the inventory of 10 different distributors in order to lower their costs by creating an in-house distribution center. Now, the main reason for this implementation was the fact that these hospitals wanted to lower their costs by taking vendors out of the equation. If we look at this from a business standpoint, the Pittsburgh Medical Center basically wanted to cut out the middleman in order to lower their overall costs and save money. Their overall goal wasn't only to just lower their expenses of the hospital, but it was actually so that they would be able to create faster lead times for their patients, as well as giving them a more affordable cost in order for them to stay relevant and compete with other healthcare companies. Now, the last slide that I will be talking about is how hospitals and healthcare systems view supply chains today. Hospitals are now beginning to understand how important managing their supply chain is. They're starting to realize the benefits and how much more efficient that they could actually be just by managing their supply chain. Certain hospital systems have fully integrated their supply chain functions and have even taken the step to assemble and manufacture their own supplies in an attempt to lower costs. Large healthcare organizations believe that the supply chain serves as a core competency within the business model. These organizations are starting to look beyond the fact of just standard healthcare and are really trying to prioritize the business aspect of this industry as well. They believe that if they can master this area, then they will be able to provide an even greater service for their consumers. Certain healthcare organizations have even begun to integrate consolidated service center models which rely on self-distribution in order to become more innovative and reach a higher level of performance. Finally, the supply chain intermediaries realize the evolution of the modern day supply chain and have decided to bring new offers to increase the value towards their upcoming and new customers.
Healthcare supply chain. Healthcare supply chain management involves obtaining resources, managing supplies, and delivering goods and services to providers and patients. Three components of the healthcare supply chain is producers. Producers are manufacturers that make and create the product. Purchasers, which are the people that buy the product in bulk from the producers and sell it to providers. And providers are hospitals, doctors, clinics that serve this product and service to consumers. Independent agents are insurance companies, regulatory agencies, and government. To complete the process, physical goods and information about medical products and services usually go through a number of independent stakeholders, including manufacturers, insurance companies, hospitals, providers, group purchasing organizations, and several regulatory agencies. Producers, like I said, are manufacturers. Some of the suppliers are medical and surgical suppliers, and they create utensils as scalpels, masks, gloves. Pharmaceuticals are the producers of drugs like pills, vaccines for the hospitals and doctors. Medical devices like respirators, especially since Corona, that's been high need and demand for it. Purchasers, wholesalers, they buy drugs and medical supplies from manufacturers, distributors. Some distributors sell a variety of products, distributes products in bulk to pharmacies, hospitals, clinics, doctors' offices, laboratories, and many other places. These products include pharmaceutical and medical equipment, while others specialize in the types of products they sell to their customers. Group Purchasing Organization, GPOs, is an entity that helps healthcare providers. Therefore, GPOs help source and negotiate prices for drugs, medical devices, and other products and services on behalf of the healthcare providers, including hospitals, nursing homes, physician practices, and home health agencies. Examples of wholesalers, distributors, and GPOs. Northwell Health Integrated Distribution Center does the receiving, packing, and shipping supplies, and the Penske drivers do the deliveries. What goes on behind the scenes in such a key part of the whole healthcare process. Those within distribution centers and warehouses had to act fast as they worked to keep supplies moving through supply chain effectively and efficiently, especially during Corona. McKesson Corporations is nation's largest distributor of wholesale medical supplies and equipment. The company has integrated additional automation into its distribution centers to complement its workforce. This has enabled McKesson to provide uninterrupted service to its providers even during high demand. Centis Corporation provides its healthcare customers with clean scrubs and towels and provide tens of thousands of customers with disinfecting and sanitizing sprays, as well as personal protective equipment, including face masks and face shields. Their staff value and takes diligent care of Centis customers and provide the products and service needed by medical institution and pharmaceutical companies. The last one is Cardinal Health. This company offers clinical, proven medical and pharmaceutical products, as well as cost-effective solutions that increase the efficiency of the supply chain from hospital to home. GPO, the primary mission of the GPO is to reduce the overall healthcare costs for its membership and contract for what the providers are purchasing and not what the manufacturers want to sell. It is a provider-centric GPO that adds substantial value to its membership. This is a quote from Jessica Ophil. Providers. So the providers are the people that serve and give the products to the consumers. So clinics, hospitals, IDNs, and nursing homes, physicians, and pharmacies are all the providers that provide medical supplies, medicine to the consumer market.
The effect that COVID-19 had on the healthcare supply chain was that at the beginning of this pandemic and now, healthcare professionals handling COVID-19 patients must be completely covered with coats, goggles, face masks, face shields, and gowns. They also needed ventilators to help combat COVID. At the beginning of the pandemic in March, the national stockpile of supplies only had 12 million N95 respirator face masks for about 18 million healthcare workers, which was not enough for each person to have one. So these face masks shipped to places with the worst cases and the worst numbers. Even then, doctors, nurses, and frontline workers would have to reuse one N95 respirator face mask over and over again by sterilizing them at the end of every shift and reusing them at the beginning of every shift. Also, the national stockpile only had 12 to 13 million ventilators, and it was later reported that here in the United States, we need about 880,000 ventilators to help combat COVID and get the coronavirus numbers down. So while capability has grown recently, the CDC states that public demand also has increased. Hospitals in the United States need to increase the supply of PPE quickly and drastically, but sourcing these items, particularly from China and India and Southeast Asia, within this COVID turmoil has brought hospital managers into uncharted territories. So lockdowns at the beginning of this pandemic in the United States, countries like China, India, and Southeast Asia were already being locked down because they already were experiencing COVID outbreaks and they needed to control it by closing all factories, all shops, all the workers had to stop working. So this had a rippling effect on the healthcare supply chain due to the fact that many of these face masks, face shields, ventilators, gloves, gowns were all produced overseas, mainly in China. When they started opening it back up, they were starting to only work at about half or below half the normal speed because they had to social distance and they couldn't overcrowd places, so they weren't able to work as fast as before COVID. The effect that COVID-19 will have on the healthcare supply chain is strong and far-reaching. So with COVID-19, demand for PPE is off the charts, while production and export is frequently limited, resulting in disturbance in supply chain that have significant consequences. Supply chain with scarcity of surgical and personal protective supplies impact the management of the epidemic of COVID-19. What do I mean by consequences? So at the beginning or before COVID-19, a lot of these PPEs were being sold at very cheap prices. For example, from personal experience, I used to import a lot of these PPEs and I still do. A box of 50-piece face masks before this pandemic would probably cost around $6 to $8. But during around March and April, when America was facing its worst time with the pandemic, a box of these face masks were to go to between $40 to $50. So price gouging was a huge problem, which also affected the supply chain severely. I'll get to that in a second. Because around March and April, when the United States had the worst time with COVID, countries like China, India, and Southeast Asia were all shut down. So there was barely any of these PPEs coming out of those countries. Anything that was coming out of those countries and making it here to the US, hospitals and states were all trying to outbid each other for the limited supply, because each and every state wanted to have their own stockpile, and every hospital wanted to outbid other hospitals to try to help save or help protect as much workers as they can. What happened was they would outbid each other, and the prices would just keep going up and up and up and up until countries like China, India, and Southeast Asia started to open up again. Once they did open up, the healthcare supply chain between raw materials and the manufacturers had huge problems, because all these manufacturers were trying to buy as much raw material as possible to make these supplies as fast as possible, to be able to ship these to the US at a drastically higher price to make as much money as possible, which dried out the raw material market for making face masks and making gloves and making ventilators, which caused them to have no more raw material. And also, manufacturers and factories that used to manufacture other things, they bought machines to produce face masks, gowns, face shields, just so they can make money off of the pandemic. So what do I mean by that? Let's say you owned a factory that was making pants or shirts in China or Indonesia or something like that. After the lockdown and everybody started going back to work, they bought machines that were able to produce face masks and all that, and stopped their old business and started producing PPEs and shipping these to the United States and charging a higher rate, because they were able to, because of the short supply that we had here, which caused people in the US to spend ridiculous amount of money to buy all these PPEs, which had a rippling effect throughout, from raw materials to manufacturers to the shipping to the wholesalers or to the companies selling these PPEs in the United States, to the hospitals, to doctors, and to the patients. So it affected the whole entire supply chain.
So the future of healthcare supply chain. The supply chain behind a variety of healthcare systems can be as or more important than the healthcare itself. Healthcare supply chain will allow for treatment to reach as many people as possible, as quickly as possible. This efficiency is achieved through finding affordable purchasers, reliable producers, trustworthy providers, proper transportation, better relationship between parties, and so on. But the future of healthcare supply chain is what is being birthed from these values of supply chain, this future being data analysis. So the thing about healthcare supply chain is that it is a gold mine of data. Healthcare supply chain produces a copious amount of transaction-focused data and outcome data. This data collected will be leveraged business-wide, even having healthcare companies and providers selling data to other companies and providers. A continuous flow of outcome data will be carefully recorded and documented. This data will be used to improve decision-making for patient care. As this collection of data grows, every section of the department of an organization will have a greater understanding of how to improve overall healthcare. Now, applying this gold mine of data within healthcare supply chain to clinicians. So, supply chain professionals and clinicians will work side by side, creating trust. Physicians will be looking to improve their processes within their practices for the greater good of their patients. So, physicians will go to supply chain professionals for guidance on these matters. Data analysis also allows for predictive analysis, giving doctors what they need before they know they need it. So supply chain professionals can use this important data and analytics to anticipate better what is needed in various parts of a practice or even a hospital. Even for problems such as products being discontinued or products being back ordered do occur, these analytics can help keep things in line and obtain replacements, for example. Providers and suppliers have a mutual goal of improving patient care and better aligning incentives. With improved supply chain data analytics, it is easier to display where changes need to be made and where improvements can be found. This makes it easier for healthcare trading partners, providers, and suppliers to have more communicative and a more collaborative relationship built upon improving the welfare of patients and just overall success as partners. Occupation opportunities, the opening of new positions within hospitals and practices to keep implemented supply chain so effective. Not only as the importance, but the magnitude of supply chain grows, there will be new roles and openings of positions and jobs being created in the field. This expanse will help the field to work towards the overall improvement of supply chain. Now, applying this data to patients. This data analysis will help provide patients with the best prices possible. As I talked about before, improved data analytics lead to a better relationship between suppliers and providers. This means that these trading partners work to improve their supply chain by cutting extra costs and finding places where money is lost. This leads to cheaper prices across supplies and medicine. Data analysis also helps create a more informed consumer and give them personalized medicine. The future supply chain will adapt to new technologies such as 3D printing, advanced imaging, advanced diagnostics, and what comes with the manufacturing and the buying processes of these technologies. Healthcare consumers now are also constantly searching and researching for the new and the best hospitals, best medicine, and best provider for them. So future supply chain will allow for this kind of shopping to occur and hopefully offer it as a service. This data analysis will also provide patients with access to better treatment, prescriptions, and equipment, as well as more efficient processes. So as I talked about before, predictive data analytics from supply chain will not only give doctors a better and quicker access to supplies they need, but patients alike. This analysis will allow for more efficient processes within a hospital or practice, helping patients spend less time waiting and more time being treated or getting access to the medicine they need. Data analytics also create higher success rates and better outcomes of treatment, which will increase as supply chain data gives better insight on how to better perform treatments. What is one problem that healthcare supply chains faced in the past? A, the high price of supplies that accounted for 17 to 30% of their costs. B, not enough healthcare workers. C, they didn't have the right technology. Or D, the workers weren't educated enough. Lockdown in which countries had a huge impact to the healthcare supply chain? A, China. B, India. C, Southeast Asia. Or D, all of the above. Finally, which purchaser helped source and negotiate prices for drugs, medical devices, and other products on behalf of healthcare providers? A, distributor. B, group purchasing organization, GPO. C, wholesaler. Or D, McKesson Corporation.